Hi everyone, it's Dr. Arshad from the Brooke Surgery, and today I'm introducing our new appointment system which is based on WhatsApp. If you have it already downloaded, it should be familiar and simple to use. For those who don't have it downloaded, please do download this on your smartphones. And if you don't have a smartphone access or you can't download it on your computer, then you're welcome to still use our phones. Downloading the WhatsApp, you need to add our contact, which is 0161 368 3312. This is our usual number to call. Add it as a contact on WhatsApp and you can start communicating with us. You would start off by saying hi so that you can start off the process. Now it's important that you verify your name and your date of birth before you give any details. Only then has the ChatDoc started. Bear in mind it's open from 7 AM till 1 PM weekdays, and we plan to extend this as time goes on. You may be used to Ask My GP, where you answer 3 questions in quick succession to get your appointment request submitted. This leads to lots of delays on our side, and we had to look at changing the system so that we can spend less time chasing appointments and actually having more appointment availability. So when you start off this chat, you will see that it's asking you to confirm you're a patient of the Brooke Surgery. I'm going to answer yes, and it's going to ask if it's an emergency. If it's an emergency, it's better that you use the emergency services, and it'll tell you what kind of things fall under an emergency, and this could be 111 or 999 depending on what symptoms you have. If it's not an emergency, you can proceed, and we are encouraging patients to use this instead of the phone lines, so that the phone lines are kept free for those who are vulnerable or don't have access to technology. Also, 5,000 patients have submitted requests through the ChatDoc and have all of their requests completed, usually within a few hours. And there were some teething problems at the beginning, and we are ironing these out as time goes on. So it's asking who this appointment request is for. I will say 1, so you answer with a number. Now, if you have someone that you care for and you need to submit 2 requests, at the end of the request, when you finish your information giving process, you simply add another line to say, I need a second request or appointment for, and the name of the person. And then what we would do is aim to close your request sooner so that you can submit the second request via the ChatDoc. So for today's purposes, I'm going to put in a date of birth. This video will be approximately about 10 minutes as I'm going into detail and discussing aspects of the appointment system in detail. But to actually use this, most patients typically find it takes them from 3 to 5 minutes to get it fully submitted. So I've put my first name, my last name, my date of birth. So this is a test patient for this requirement. NHS number, if you don't know, you put an X. Now this is the important part. You've got 6 numbers here to tell you what you may need. So for instance, if you wanted a medication request, you write number 5. Bear in mind, we are asking patients to use the NHS app to do this. And to amend a cancel appointment, you press 2. Also bear in mind that our phone lines are able to do this before you queue up. So if you were to phone our number, it will allow you to cancel an appointment just by putting in your details. Most of the things that you have in mind should be covered by these 6 numbers. If they're not, or if it's a health problem, you would press 1. So once you press 1, it will now present you with another list of types of appointments. So have you discussed this with someone before? I will say no. And these are the main things that people generally contact us for. So if it falls in one of these categories, like for instance, if you have an ear problem, you say 6, or mental health problem 7. For those who couldn't find a number that suited their query in the initial screen, you'd come to this screen and write 12 for something else, and then you would continue, so that it'd still come through to our system and we will still see it. Also, I want to mention that, so I will use number 12 today to show you, that every single request is seen by one of our staff, whether that's a clinical member or an admin member of staff. None of the requests are handled purely just by the questions here. So please describe this problem for us. So if it was an ear problem, you would press number 6, but I'm going to write ear pain for this particular ear pain for 3 days. What it will do is ask some predetermined questions about how long you've had the problem for. So 3 days, so I'll put number 2 here because that says 1 to 7 days. So this will there's some questions to answer here. Have you tried anything to treat the problem? No. So you can see we started this about 10:32, these particular questions. Anything concerning you? Worried it might be an infection. So it's going to ask you more detailed questions. And this really helps us because it allows us to triage significantly quicker and allows us to determine which clinician you need to see. So questions will be asked after this. Describe the pain shooting dogs. So I'll just say it's a dull pain. Is asking where the pain is, so I will say it's in the left ear. I'll say no. No. Asking about if I have a fever, headache, or a sore throat, which could be related to the ear pain. Similarly, this question about having infections or cold can be related to the ear pain too, and I'm going to answer no. So no fluid from the ear. No injury or head trauma. And these are all relevant because it will allow us to determine if this is actually in a medical emergency. No ear problems in the past. So this is also relevant if you've been having a bath, swimming, because sometimes water can pool in the ear, which predisposes you to ear infections. Allergies can also cause swelling around the ear, so that's also a relevant question. So some of these may seem irrelevant, but actually they have some benefit of being asked because it'll allow us to understand where the problem could be coming from. This one's also very important. It tells us if we're worried about any of the bones around the ear. And asking about swelling or redness as well, which would indicate a skin problem as opposed to an eardrum problem. And this is also very important because your ear is responsible for your balance centers. So for some, you may look at this and think it might not be related, but actually it is related. Have I taken any pain relief? Here I've said paracetamol. Asking how helpful the paracetamol has been, which is important because then we can discuss pain relief with you if it's not helping. And now it's finishing off with how do you want to be seen. So this is what your request may be. You may want to be seen in a particular way, whether it's a message, a phone call, or a face-to-face. It allows us to know what your preference is. Often you'll find that you will be presented with a booking link following this. So it says here, we'll try to reply within 24 hours. Usually we reply much quicker than this, especially if you are using the WhatsApp directly. And if you needed a second appointment, you would just write something here. So I need an appointment for my 5-year-old son's skin problem, please. This will prompt us to close this request sooner and allow you to submit that. So putting this information is vital for those who care for others, who have multiple people in their households, especially when you don't have any other WhatsApp numbers available to request this on. That is one option, using a second WhatsApp number, but the option that we would advise you to do if you're unable to do so is putting the message here. We will then either start chatting to you on here, and it will be always done by a staff member, or present you with a booking link to get seen, and that could be a telephone consultation or it could be a face-to-face. So please do use this appointment system. We are actively listening to your feedback. You have left us lots of feedback and we find it very valuable, and we're working on improving any of the kinks in the system But please do use this instead of the phone lines. It will allow us to triage you significantly quicker and leave the lines open for those who are vulnerable. Thank you very much.